Many parents come to my clinic. They say that child is not able to sit on correct age or not able to walk at the correct age, but other milestones are normal, like the social smile is normal and responding to all other activities are absolutely normal. So maybe this is because of the weakening of the bones, and in medical terms we call it rickets. Rickets is a disease in which body is deficient in calcium, vitamin D and phosphorus. Even if sometimes the vitamin D is normal, their body has difficulty in utilizing vitamin D. Now coming to the causes of rickets. Sometimes the infants are born to mother having low level of calcium and vitamin D. Naturally, if the calcium and vitamin D level is low in mother, it will be less amount will be transferred to the baby in last trimester. Second cause is preterm infant. As I said, calcium and vitamin D is mostly transferred in the last trimester. If the baby is born prematurely, naturally the transfer is not sufficient. That leads to rickets later in the life. Third is exclusively breastfed infants. You will be surprised. Breastfeeding is considered the best form of nutrition. Yes, very true. Breastfeeding is no doubt best form of nutrition, but it is deficient in only one thing, that is vitamin D. So if the baby is exclusively breastfeed, kindly supplement vitamin D to the infant. Children having very low exposure to sun. There are many countries where the sun exposure overall in general is very low. And sometimes it happens in sunny countries also, especially in middle class or upper middle class or upper class, because they are mostly indoors. Their exposure to sun is very low. Even if they go out in sun, they use sunscreens. Next is dark skin children. Dark skin children have limited absorption of vitamin D. Diet deficient in vitamin D and calcium. Children suffering from any malabsorption syndrome, even if they are taking sufficient amount of calcium and vitamin D in diet, because of less absorption, there is less availability in the body, leading to rickets. Certain intake of medications like anti-seizure medications and anti-retroviral medications, they interfere with body's ability to use vitamin D, and they also lead to rickets. Now coming to what are the clinical features of rickets. There can be delayed growth in the child, there can be delayed motor skills in the child, there can be pain in the spine, pelvis and legs. There can be muscle weakness. All growing bones in infants or children have got a growth cartilage which needs calcium and phosphorus for proper growth. Reduced vitamin D level leads to less absorption of calcium and phosphorus, leading to less deposition in the bones, leading to softening of bones. There is large fontanelle. Fontanelle is an area, soft area on the top of the skull in infants that becomes very large. Skull in infant become very soft. It becomes like a tennis ball. When we press it, it presses like a tennis ball, and this thing is called craniotabes. There is delayed eruption of teeth. Soft bones leading to bowing of legs. Naturally, when the bones are soft and pressure is applied, there will be bowing. When pressure is applied on the bone, the ends of bones become larger than normal. In that case, the joints like wrist joint, ankle joint, knee joint, they appear swollen. Bleeding of ribs, there can be in drawing of chest at certain area. The chest can have the shape of the pigeon because it appears protruded. That is called pigeon chest. So what investigations we need to do? We need to estimate the level of vitamin D, calcium and phosphorus, which is lower than normal. We also need to estimate the level of serum alkaline phosphatase, which is higher than the normal, and we need to do the x-ray of ends of the bone which contains growth cartilage. There one can see the changes. As I always say, prevention is always better than cures. So how can we prevent this condition? Eating the diet containing calcium and vitamin D. Second is exposure to sunlight. During most seasons, exposure to sunlight for 10 to 15 minutes at the time of midday is sufficient. Now how to manage this condition once it is diagnosed? Naturally, we have to supplement calcium, phosphorus and vitamin D level according to weight and age of the child. Fish oil, egg yolk and fatty fish such as salmon, they contain plenty of vitamin D. Some companies fortify milk, cereal and juices with vitamin D. Sometimes treatment of kidney disease also corrects the rickets. Initially, it can be treated by braces. When the bone deformity is very severe, we need to have corrective surgery for it. Encourage child to have exercise, because when if the child does mild exercises like jumping, walking or running, the bones become stronger. So I have shared everything which I thought needed sharing with you about rickets. If you like the video, kindly like, share and subscribe, and please don't forget to press the bell icon. Thank you.